So my name's John Christodoulou. I'm based at the Children's Hospital at Westmead. I trained initially as a paediatrician and then in genetics, and one of my long-term research focus has been Rett syndrome. And in particular, we've been keen to understand the biology of Rett syndrome so that we could hopefully get a better understanding of how we might develop targeted therapies for the disorder. And so most recently we've identified that there are abnormalities in the way proteins and components within brain cells are transported from one part of the cell to the other. And it's been recognised that there are drugs that can specifically target that to improve the capacity to be able to do that. And so that's something that we're currently working on in a mouse model that hopefully we'll be able to move into the clinic in due course. When you're thinking about working with a brand new drug that has never been used in patient care before, that's a much slower process in terms of getting it from the bench to the bedside, which may take 5 years or more. And needs considerable investment, particularly from pharmaceutical companies, to help partner up to be able to move that way. So ideally, if we can identify drugs that already exist, that have been used for other purposes, that are safe, then we might be able to, what we say, repurpose those drugs to then be able to use them specifically for Rett. BDNF is an important protein that helps brain cells to flourish and work properly, and it's been shown both in the Rett mouse models and in samples from Rett patients that BDNF levels are actually low. And so if you had a strategy to be able to increase the level of BDNF or to increase the efficiency that BDNF is doing its job, then that could have a positive effect. And there are a number of drugs, IGF-1, the neuron equivalent, and other drugs that are focused on improving BDNF levels in the brain, which are showing some significant promise in terms of their capacity to help, and that's why there's been clinical trials focused on those at the moment. I've known Janelle for a long time, over 15 years, and she was a real stalwart and supporter of our research, particularly in the early years, and through her fundraising efforts and her engagement with, in particular, the Rotary Club of Narellan. For a number of years they raised funds that they gave to our group to foster our research. So I'm forever grateful to Janelle for having supported us, particularly in the early years, to get us a grounding so we could then go for competitive funding. So initially the RSAA was primarily focused on providing support to families and the caregivers of individuals with Rett syndrome. But in more recent years they've been starting to get more enthusiasm for fundraising to help support research around the country. And so hopefully that'll be something that continues to build in the coming years.